You could become infected with the Zika virus through a mosquito bite or a person who is carrying the virus. The Zika virus has traveled thousands of miles from South America to Texas in less than 2 years. Tonight, Channel 5's Christian Von Preissing takes a closer look at how quickly it's moving.
This equipment right here is being used by health employees on the front lines of the Zika migration here in the valley, and they're trying to track using this equipment how far mosquitoes are traveling and how many of them there are. Well, now more than ever in recent days, this equipment is becoming more essential. This is where McAllen has its mosquito lab.
Call it a light trap because it has a little light.
It's actually the lab at Texas A&M School of Public Health. These traps are pieced together.
Next to that one.
Those mosquitoes attracted to carbon dioxide coming from this thermos.
The mosquito comes in.
They work by sucking in mosquitoes.
Fan catches it, brings it all the way down to
the Aedes aegypti mosquito is on the move. These traps are showing health workers like Aaron Suarez where they end up going.
That's what it is.
Years ago, scientists set up traps like these in the Rio Grande Valley in a controlled experiment. They connected where mosquitoes were born to where they ended up.
We detected mosquitoes as far as 2 miles. That 3rd mile marker, we were not able to collect the mosquito because it was too windy.
Health Director Josh Ramirez says after hatching from a water source, Aedes aegypti typically travel a mile to look for a host to bite. Winds push mosquitoes even further, like in the summer when they come north from Mexico.
Generally from May through September, almost every day the wind is from the south or southeast.
The winds that we get in the summer come from Mexico. Earlier this year, across our border, Tamaulipas confirmed its own cases of Zika. Before that, in early 2015, the World Health Organization received reports of the Zika virus in Brazil. Now the virus is here in the Rio Grande Valley. It's transmitted by the Aedes aegypti and another species, the Aedes albopictus. If that mosquito bites me and I've got Zika, then the mosquito gets Zika. And then if it bites you, you can get Zika too. The Centers for Disease Control is telling people Zika can spread through sex, through birth, and through mosquito. The insect is still on the move in the valley, looking for its next host. Ramirez says he's not just concerned about how far mosquitoes can fly.
The mosquito can die and might not be able to transmit the virus to anybody else.
One mosquito by itself has a hard time staying alive. Ramirez is much more concerned about a human carrier.
They can be infected in Central America one morning, hop in a plane, travel to Dallas.
That person becomes a vessel. They can be bitten countless times. Countless meals for many hungry mosquitoes.
That's more concerning to us.
That's what these health workers are working to halt as the Zika virus keeps spreading. In McAllen, Christian Von Preissing, Channel 5 News at 10.